At this stage, she does not need antiretroviral. She's healthy enough for us to monitor her progress.
Okay.
She's not in any trouble at the moment. But in the end, all our children will be on antiretroviral therapy. That is our ideal. That is what we're working towards.
Ngaphandle kwalento manje iphuma ilantuka ezinto ezilapha nangona imthengele ezinye iphilisi apha iphilisi lendithengile sisusile ezanti beziphume kakhulu apha ngoba ndaxela ugqirha pha eTigerberg kuba lo mntana uphuma izinto athi akho nto banoyenza phana kuba banike nete ezi vitamins ndamthengela ezi ke ngoku ekhemist siyazinceda kakhulu ke ngoku izinto.
This is the Bactrim, okay? It's an antibiotic. We give the Bactrim to the children to ensure that their lungs are kept PCP-free, which is the other lung infection that we're trying to prevent. Okay. Now with the previous bloods that we did and also the staging that we did, Caroline's doing incredibly well. And she's a stage A1. Okay. So stage A is the best stage that we can get in HIV infection. Okay. It's the most healthiest. All our healthy children are stage A. Okay. And then 1 is also the best.
If we know that they're HIV positive, then we can start to work with the parents and say, right, your child has got this disease. We need to try to keep the child as well as possible. We need to try and do everything that we can to keep the child well before the child needs antiretroviral treatment.
40% of children will present with AIDS by 1 to 2 years and die within that time period. Another 40% will present at about 5 to 6 years. And at that stage they will present once again with AIDS and die within that time period. The long-term non-progressors, which is about 10%, are the exception, not the rule.
Ndinolist Mbambatho ndihlala HIV positive ndihlala apha eMakhaza ko42 ndinomntana ongubusisiwe Mbambatho naye HIV positive phila nentsholongwane saye saziva ngona ndayeva ngosekugule yena ngo1998 pha ekupheleni pha ngo-October ngose agule eRetros kwathiwa HIV positive. Ubusiso into ayimhluphi kakhulu yayi-TB kunye ne-rush apha emzimbeni. Wayene-rush apha emzimbeni echiza ke nendlebe ke. Ngoku ebengakatyi i-ARVs ebenikwa iyeza kuthiwa iBatrim elimhlophe.
I'm Natalie Clark. I'm one of the senior medical officers working at Victoria Hospital in the pediatric department. We run a very busy pediatric service here. We have a ward for between 25 and 28 full-time inpatients, looking after children with a variety of medical and surgical problems. On a Tuesday afternoon, we have a clinic specifically for children who are HIV positive. The children that we see who are HIV positive present with a variety of symptoms, and it really depends on the extent and the severity of their disease. In our experience, we've seen quite often two things. Firstly, the one, recurrent respiratory tract infections, whether they're just bacterial infections or whether it's actually TB. A number of our children actually present with TB. I think it's important for general basic healthcare to come first in terms of looking after a child who is HIV positive or a child who you suspect is HIV positive. And it's things, you can give a child as much medication as you like, but if you can't provide them with a roof and shelter over their heads, clean water, adequate hygiene and a nutritious diet, no amount of medication is actually going to do the trick. If you're not in an area where water is fresh from a tap, then water needs to be boiled. I think the most important thing to start off with is to make sure that a child is well nourished. They need to be getting some form of protein.
My name is Marta Bedelu. I'm a medical doctor working in the HIV clinic at Michael Mopongwana Day Hospital. This particular girl used to have recurrent chest infections, lung infections, which had been frequently being treated. She had been having some oral infections with fungus, which has been also was treated at the meantime, and gastrointestinal. She's been having diarrheas, recurrent diarrheas now and then. But eventually, after she passed through the counselling process, the antiretroviral treatment was started, and her condition has improved.
Go February 2002, waqalisa yini ARVs. Andozuqoka okumntana moto waqalisa ARVs. Zanga phinda bengumhlalo wase Red Cross engazange aphinda kule qha ngoku into anayo ngoku ngalomzuzu sithethayo zindlebe nazo ziyekile ukuchiza qha umane ehamba ke ngoku check up for indlebe take up back.